Here at OrthoCarolina, in collaboration with our research arm, OrthoCarolina Research Institute, we recently did a 1,000-patient clinical study looking at outcomes and predictors of Achilles rupture. We were particularly interested in why are people rupturing their Achilles now as compared to 5 years ago, because we were noticing more people rupture their Achilles playing pickleball. And sure enough, we've seen an increase in pickleball-related Achilles ruptures. My name's Sam Ford. I'm an orthopedic foot and ankle specialist at OrthoCarolina. I'm part of the Foot and Ankle Institute. The Achilles tendon is our largest tendon. We can all feel it, it's right below the skin. Most people never having a problem with their Achilles, but the mid portion of the Achilles tendon has bad blood supply. So most commonly people either develop tendinitis or have a rupture, which means the tendon tears in two, almost like two mop ends. Those two problems can be related. We think the primary reason is because the middle of the tendon has bad blood supply. And that's because the blood supply from the top comes from the muscle and the blood supply from the bottom comes from the heel bone where it attaches. But in the middle, there's not very good blood supply. And in that zone, if you put too much stress over time through the tendon, you can get tendinitis, and that can predispose you if you do anything quick. We all know people who picked up pickleball as a new sport. A lot of people started playing golf, a lot of people started playing tennis, but pickleball kind of came out as sort of a social way to be active but distanced at the same time. Really what we saw was more and more people coming in with Achilles ruptures that wouldn't have otherwise had them. Really what we wanted to do with our research was ask the question, have the reasons that people rupture their Achilles, have they changed over time? And the answer is yes. Achilles ruptures because of pickleball are now happening more frequently by 3 or 4 times what they were happening pre-pandemic. Now, we don't think that's because there's something inherently wrong with pickleball. We think it's because more people are playing pickleball. We think it's a numbers game. The landscape of who's getting Achilles ruptures has changed over the last 5 years, and now we can counsel our patients more on what is safe and not safe to do. If a 55-year-old who's been playing pickleball the last 6 months comes to me and says, hey, my Achilles is a little sore, maybe before I would have told them, yeah, it's fine to play pickleball, because I didn't really understand the risk that that sport was posing to that patient. But now I can tell them, look, we need to stop, get you in a boot for 4 to 6 weeks, get you on an anti-inflammatory, get you to a physical therapist. We need to get your tendinitis better so that you can go back to doing what you want to do without an increased injury risk. There's a clear link between having a painful Achilles or Achilles tendinitis and putting yourself at risk for rupture. That same cohort of patients is the cohort who tends to say, I'm supposed to ache and hurt at this age. It's fine. I know that my Achilles is hurting now and it wasn't 3 months ago. It's probably because I'm just doing something new. You're still at risk for an injury that you weren't at risk for before. We need to treat that so that we can reduce your risk and you avoid the rupture. To prevent Achilles injury, if you are playing pickleball or tennis or football or basketball or any high-risk sport where there's sudden stops, sudden starts, pushing off quickly, changing direction quickly, you need to warm up before. So 5 or 10 minutes of walking or running or being on an elliptical or a treadmill, and then stretching. A lot of times these injuries happen early in the athletic endeavor. You'll hear people say, it was the second point. I tried to cut one direction and pop. Well, your tendon hasn't had a chance to warm up, your muscles haven't had a chance to warm up and get more elastic.